Hi, I'm Terrence Kommal. I'm in the esteemed presence and have the great pleasure of spending some time with Professor Tarun Khanna of the Harvard Business School at Harvard University. Professor, thank you for making the time.
Thank you, Terrence.
Professor, there's conversations with the World Economic Forum and what they colloquially call the Davos circles, but actually a global theme at the moment is sustainable business and creating value along the entire value chain, not just profiteering. What do you think about that?
So let me illustrate the creating conditions to create and this idea of sustainable business, which is a trendy term in the past few years,
Yes.
with an example. So one of my favorite examples, and we did a energizing case discussion on this, is the Narayana hospitals in Bangalore. So this is the world's lowest cost provider of tertiary cardiac care, and possibly the world's lowest cost provider of tertiary care of many other disease conditions.
Yes.
Now, the way the surgeon entrepreneur has gone about building this over the past decade plus is not just to develop what I would call a sort of Henry Ford factory line of heart surgery, which sounds heartless, no pun intended, but actually is the most compassionate way to deliver care at a very affordable price point to extremely poor people. But what I want to draw attention to is that in order to get massive numbers of, in that case, Indian patients coming to the clinic, he's also had to invest in the enabling conditions that allow them to get to the clinic. So there's no health insurance. It's very difficult for people in remote villages to get access to information about heart surgery. They have to care for themselves and their families when they're going to the treatment. And in each of these cases, the entrepreneur, Dr. Shetty, has either had to do something about that space proactively through the enterprise, or induce others, either in the private sector or in the public space, to do something about it.
Sure.
As an example, some of his earliest efforts triggered health insurance in India. Even though he ended up not being the primary insurance provider, there are lots of other people who were catalyzed by the early action, including the state government in the state in which Bangalore is. Another example would be pioneering telemedicine in the country in partnership with the government agency that is responsible for satellites, and so on and so forth. So now, that kind of approach of creating the conditions to create has also enabled value creation for a variety of stakeholders along the way. It's created value for hotels and an ecosystem of service providers that have popped up around the health city that he's built. It's created value for transportation companies that are bringing patients in there. It's created value for video conference facilities to provide telemedicine services. And so you can see that once you create these conditions, there are immediate spillover benefits, or what economists would call positive externalities, that are immediately visited upon the environment. So sustainable business is a corollary, an immediate corollary to what I'm advocating of creating the conditions to create.
Fantastic.